Hi everyone, my name is Kate Bosteder. I am a clinical exercise physiologist and research scientist at Baylor Scott & White Sports Therapy and Research Center at the Star in Frisco, Texas. I am excited to share with you our project titled Overground Robotic Exoskeleton Gait Training Intensity in Patients with Spinal Cord Injuries. I have no conflicts of interest related to this presentation to share with you all today, so we can jump right into the introduction. High-intensity gait training early on, including during inpatient rehabilitation, promotes functional recovery following spinal cord injury. However, due to the neuromuscular and autonomic impairments associated with spinal cord injury, assessing intensity through traditional methods such as heart rate response or ratings of perceived exertion may be inaccurate, resulting in a gross underestimation of intensity. Wearable metabolic systems, such as metabolic carts, have been used to directly measure intensity using oxygen consumption, or VO2, in persons with spinal cord injury and may be a more accurate assessment of intensity. Advances in rehabilitation technology have allowed for the implementation of overground robotic exoskeletons in inpatient rehabilitation, which allow patients with mobility impairments to perform upright stepping exercise with variable levels of assistance. Because of this, higher levels of intensity may be able to be achieved during overground robotic exoskeleton gait training. However, the use of a wearable metabolic system to assess intensity during overground exoskeleton gait training in the inpatient rehab setting is unexplored. The purpose of the present study is to describe the use of a wearable metabolic system to measure the physiological intensity of overground robotic exoskeleton gait training in patients with a motor incomplete spinal cord injury during inpatient rehabilitation. Now, before I jump into the details of the study, I want to share a little bit with you about my story. That way, I can give you some context into why I'm talking about neurorehabilitation. For about 8 years, I worked as a clinical exercise physiologist in a cardiac rehabilitation, where I participated in research activities with cardiac physicians in addition to my clinical duties. Due to the importance of physical activity in nearly all of our clinical service lines, I was hired as our healthcare system's first research clinical exercise physiologist and eventually research scientist. Now I work with a very diverse group of clinicians and community partners, and I work to identify novel interventions that can promote physical activities sufficient to improve cardiovascular health and quality of life in a variety of patient populations, including patients with spinal cord injuries. As a CEP, I bring a unique skill set into the service line, allowing for increased specificity and sensitivity in our clinical research involving the neuropopulation, but I also collaborate to bring neurorehab modalities, like our robotic exoskeleton, into other areas like our cardiac rehabilitation or prehabilitation. So back to the study at hand, we conducted an observational study that included adults aged 18 to 85 admitted to our inpatient rehab with a diagnosis of a motor incomplete spinal cord injury, who were eligible to initiate overground robotic exoskeleton gait training, which we further describe in our protocol paper. Overground robotic exoskeleton gait training intensity, duration, and step count were assessed during one session that was performed during a week of gait training initiation following their inpatient admission. Intensity was assessed by ratings of perceived exertion, which was our standard of care, and VO2 with a wearable metabolic cart, which was expressed in metabolic equivalents, or METs, with moderate and high intensity defined as greater than 3 and greater than 6 METs respectively, with 1 MET equaling 2.7 mils per minute per kilogram of VO2, based on literature describing the decreased fat-free mass in persons with spinal cord injury. We had 4 persons, mostly male, half of whom were Hispanic, and participant characteristics included 3 persons, so 75%, that were diagnosed with Asia Impairment Scale C, and 1, 25%, that was diagnosed with Asia Impairment Scale D. That was 50% of patients were tetraplegic and 50% were paraplegic. All were admitted at about 30 days after their injury, although there was a pretty wide range. And duration of overground robotic exoskeleton gait training sessions was about 16 minutes with a range of about 11 to 20 minutes. And participants completed 512 steps on average with an RPE of about 4. VO2 on average was 7.3 and METs were about 2.72. It is important to note that 3 of the 4 participants achieved greater than 3 METs, so moderate intensity, for 80 to 90% of the session, and greater than 6 METs for a pretty wide range of 4.2 to 54.8% of the session, with VO2 being the highest in the participant with ASIA D. The key takeaway from the study is that the wearable metabolic cart was a feasible method to obtain intensity data during overground robotic exoskeleton gait training in adults following admission to inpatient rehab after a spinal cord injury. These results helped inform our current and future research directions, including exploring the utility of the robotic exoskeleton to serve as an aerobic exercise modality that can help individuals with spinal cord injury achieve high-intensity exercise that helps reduce their risk of cardiovascular disease. Specifically, the addition of a clinical exercise physiologist skill set into the neurorehabilitation research program has inspired current and future utilization of metabolic assessments and different patient-specific physiological measures that allow us to explore how overground robotic exoskeleton gait training can be used in different settings, including the acute care, which you can see in our REACT study on the left of the screen, which is aimed at promoting early mobility in the hospital, all the way across the continuum of care into the community setting, which is what we hope to address with our Cardio for SEI and Rockstar projects. So hopefully much more to come on implementing these overground robotic exoskeleton gait trainings sessions into patients of a variety of populations. Here are the references that I used in this presentation, and thank you guys so much for listening to my talk. If you have any questions or just want to chat, please feel free to reach out. This is my contact information, and I would love to chat with you.